First at noon, though, coronavirus concerns continue. Lawmakers, health officials trying to limit contact with those who are infected. While one suburb in New York City, New Rochelle, New York, is now under a 1-mile containment zone, and the governor of Washington State may soon ban gatherings of more than 250 people in the Seattle metro area. Here's the latest nationwide. 1,000 people have been diagnosed with the coronavirus. 31 have died. In Rhode Island, 3 people are confirmed positively diagnosed with the coronavirus. In Massachusetts, that number is now at 92. Here in Rhode Island, Department of Health and Governor Raimondo had scheduled a news conference update to take place at noon today. It has now been postponed until 4 o'clock this afternoon. We will bring it to you live, streaming on our website, WPRI.com. New at noon, another Southern New England college, Wheaton, has also moved its classes online for the very near future, and another Rhode Island hospital group announcing restrictions for visitors. That would be Care New England. Let's bring in Eyewitness News reporter Alexandra Leslie. She joins us now live from Kent Hospital in Warwick with more.
Good afternoon. Well, it's a system-wide no visitor policy in effect for all Care New England hospitals, including here at Kent. This policy went into effect this morning. The visitor parking lots in Rhode Island hospitals won't be as full. Hospitals across the state now with varying policies in effect for patient visitors. This morning, Care New England announced a system-wide no visitor policy with some exceptions. Specifically, visitors won't be allowed to see inpatients, but one support person will be allowed in the obstetric unit. NICU patients will be allowed 2 support persons, and only 1 adult is allowed in the emergency department, but for limited time in patient areas. The sweeping restrictions come about a week after Lifespan put out a notice patient visitation was suspended at all of its hospitals. It meant no visitors would be allowed in the adult units at Lifespan facilities, including Rhode Island Hospital and the Merriam.
It's a large number of people who come to the hospital every day, and in a situation like this where the prevalence of the infection is not that well known, it's, I think, better to be overcautious and limit the flow of those people rather than expose people unnecessarily to the illness.
Safety first. I just don't want him contracting it too.
It had folks like Brenda D'Agostino, whose husband is in Merriam Hospital with heart problems, upset she can't be by his side, though she understands.
I fight for him, he fights for me. But after 27 years, you know, you gotta be there for each other because nobody else is going to.
Now, in a statement from Care New England's president and CEO, it said that each of its hospitals would have communication to go out to staff, family, and friends to make sure that they were all aware of the temporary restrictions. Live in Warwick, Alexandra Leslie, Eyewitness News.